and welcome to another Ask Julie Anything. Uh, as you know, my name is Mariana Nadai or Mariana Nadai, like my kids say that I have to say my name, and I'll be your host today. November is Pet Cancer Awareness Month, and as pet parents, a cancer diagnosis is something we all fear. So tonight, our ABA founder and formulator, Julie Anne Lee, wants to try to make things a little easier. During the session, Julie will give you her perspective and help you navigate this challenging time with your adore beast. Plus, she will answer your questions live, so don't be shy and ask Julie anything. And before we start, I want to remind you about some housekeeping rules. Please switch your chat to everyone so we can all join in the conversations. Use the Q&A box below to ask your questions. The questions will be answered in order, first come, first served, and we will do our best to cover as many questions as possible. And please keep your questions related to today's topic, so related to cancer. To ensure everyone has a chance to participate, we will be taking one question per person. And please try to keep your questions brief and short so that as many people as possible can have their questions answered. Thank you for your understanding. And I know that sometimes it's very hard to be concise, but I hope you guys can try harder so we can have we can answer as many questions as possible. And the most important thing of all, the session provides a judgment-free space with only the health and happiness of our animals and the planet being our core goal. And I was going to finish here saying without further ado, Julie Anne Lee, the floor is yours, but no. So hi, the floor is yours, Julie.
Hi, and I was trying to get my background on, but I'm using my laptop, so I can't.
That's fine.
I know. Sorry about that,
You have
guys.
a nice setup. So
Not
it's
that professional. And I'm trying to see, and I can't see because my glasses are all dirty.
and
Pardon?
no, I was going to say that you were not here with me since the beginning, as you usually are,
Oh man.
because, yeah, I guess you were gonna talk to everyone about this big
About what?
news.
About what we're doing, you mean, or
No,
about
about why you were not here since
why I
the
was late?
very first start. Yeah.
I I just rescued two dogs. One from the kill shelter in Texas, a little tiny one. Her name is Hazel, and a galgo from Spain. His name is Tino, and it's amazing, like just watching them and stuff. But normally I would have to take him out and say, "Come on, let's go outside," because they're both quite fearful and timid. And um, last night and today is the first time he's actually asking to go out. So, yeah. So I took him out like an hour ago, just like, do you have to pee just before this starts? And he's like, yeah, okay, I'll pee. But now he just asked to go out like literally what, 3 minutes ago.
Yeah.
Like, oh no, I can't not take him out. And then how if he really does have to go out. And oh my gosh. Anyways, so I was running out in the dark, couldn't see anything and stumbling around in my slippers because I couldn't find my boots. Anyways, so that's what's happening right now. I'm trying to decide, guys, whether or not the best way to approach this is to just talk to you guys one on one or one on 100 or whatever, whoever's watching, and speak to you like I would be speaking to anybody, whether they were a client bringing in a patient or whether it was a friend, whether it was a human friend with cancer or relative or, a pet parent. And I think for a long time now, I've been trying to uh, look at cancer in a different way. And I did a lecture, oh my gosh, like 8 years ago now with Dogs Naturally magazine in Chicago, and basically just about that, what would it feel like if you took your animal in and they told you, instead of using the word cancer, they use the word, severe chronic disease, because people and animals can die from chronic disease just like they can from cancer. So, and I think that maybe there's such a fear factor with it, and I understand why, and I think it's because no one really understands it. We have oncologists, and then we have specialists, and we have all of this stuff, and I feel like, even here, can you hear her? She's reverse sneezing. I know she's got this reverse sneeze. So I think it was from her rabies vaccine, but that she had just literally before she got here. But sorry. But I think that when we look at it from a different perspective, my hope is that it's more understandable and maybe a tiny bit less scary. And I'm not an oncologist. I'm not, a cancer specialist. I've been in canine cancer research with Dalhousie University now for 7 years, I think, 7 years, and doing amazing, phenomenal work with Dal. But what the cancer research from Dal is showing me, more than showing me all this amazing stuff that we're seeing with cells, and things that are cytotoxic, and just all this wonderful research. What it's showing me is this amazing ability to understand the process, or simplify the process, or for me, it was to watch how the natural ingredients that we're using for this cancer research work together in synergy to create something exponentially beautiful in the body, and something that is beyond imaginable, that I never even thought. Well, I did think it could happen, but I wasn't really sure how it was going to happen. But what I'm trying to say is, what the most exciting part of this cancer research is seeing the innate wisdom that these two ingredients have that we're using, which is chaga mushroom and phytosynergy, or like phytoplankton, but it is our phytosynergy. How they work on the cancer cells independently, like together, but in their own way. So not in the way that the scientist thinks that they should, not in the way that I thought maybe they should, but my goal was that if we paid attention enough, it would be able to show us what we were supposed to do. And that's exactly what it did. And it blew me away, because what it did is it gave me a lot more hope. So it didn't like blow up my ego and think like, oh, wow, look at this. And this does this for cancer cells. And it's maintaining the healthy cells. So it's not killing the healthy cells like it's killing the cancer cells, which was, which is like, which was what Dal was the most excited about. But what it did was it really gave me hope that if we allow nature to sort of guide us into what we need to do for not just cancer, but for anything like cancer, the environment, or climate change, however we want to look at it. If we step back, remove our ego by thinking that we know better than nature, and allow nature to show us, it really can. And it's showing us in this cancer research beyond imaginable. And it just proves to me my hypothesis, my theory, my whatever. Not just me. I mean, Jane Goodall was like that, and Zach Bush is like that. There's lots of people with this philosophy that nature is what's resistant. Nature is what is trying to right itself by climate change, right? It's trying to right itself, but it can't because we keep interfering. So when we look at cancer or we look at chronic disease in a similar fashion of how are we seeing the effects of the environment? What are we doing that is causing climate change? What are we doing that's causing this climate crisis? What are we doing that's causing the destruction of our planet and the destruction of actually like our atmosphere and what are we doing? So when we look at that, we can apply that to what we're doing to our animals, ourselves, our children, our family, to our health, right? To the health of anything that's alive. And if we can break it down, the exciting part for me is once people understand what is actually happening in the on the planet, in our bodies, in our animals' bodies, maybe there'll be an awareness or an awakening of if we work together to heal kind of with the idea, or if we look at this whole process of disease, and let's just lock cancer in with disease for now. If we look at the process of disease and destruction, it's the same. And if we can move into a place where we have this awareness to keep ourselves healthy and our animals healthy, I don't think it's a far stretch for us to understand how we can also do it for the planet. And there's a lot of hope there. There's a lot of hopelessness right now in the world about a lot of things. But I really feel like the one thing that we can lean on that we're kind of ignoring is nature. And if we lean on nature a little more and um how that happens, like what happens, I think we can make massive shifts in cancer. I think we can make massive shifts in chronic disease. I think we can make massive shifts in our ability to breathe and in our climate change and our overall well-being while we're living, right? While and for hopefully a long time to come. So maybe what I should do is I wish I could get, do you think we could, Mariana, could we get sort of like a fast poll? I don't even know if we can. If people want me to talk about um what I feel like, you know, the links that I've made between my research and cancer and how I look at cancer and how do you think that or should I just go right into questions? Because I know we're going to have a billion questions.
Um, I would say, I mean, I can make the poll, I can put the poll up, but I have the feeling that maybe we could go to the questions and then we can share the slides with the cancer research and even the other webinar that we made in the beginning of this year, talking more about
Yeah.
the cancer research and the
Yeah.
findings and everything. What do you think?
Yeah, I mean, we can do that. We can definitely do that. Let me just look at some of the questions.
Because the first one is already a good one, I guess, for us to start.
Yeah, so I think that yeah, maybe what we'll do is I'll answer some questions, and if I feel like I need to like stop for a minute
Mm-hmm.
and take a look at why I feel cancer is so prominent right now,
Okay.
um, then I can do that too. So, 16-year-old female, you know what? Let me just say a couple of I wonder
Okay.
if I think I might just quickly share four of those slides.
Okay.
And then I'll quickly get into the questions because
Okay.
if people are here, there could be some people here that don't have questions and some people here that want to know maybe a little bit more about just about my philosophy of cancer.
Of
Um,
course.
So why don't I'm gonna have to shrink this though and find, um,
If you didn't close, they were open
uh,
in your computer from earlier.
yeah, I've got them here. Okay, can you guys see that?
Yeah.
All right, so I'm going to I think I will I'll do them as a slideshow like that. Okay, so you can see that.
Yes, perfect.
So the reason that I wanted to, oh, I knew it was gonna do that.
Just
Reason that I think it's important to talk about this is because one of my feelings about what causes cancer or what causes severe life-threatening chronic disease is that we are bombarding our bodies and our animals' bodies with um, so many things that cause oxidative stress and cell death. So toxins and, environmental toxins and pollution and things that we're eating and things that are in their food and flea control and over vaccinations and stress levels. Like the list goes on and on and on of what the body has to deal with from a perspective of uh, what the cells have to defend themselves to. And the rapid rate of cell death because of all of this external stuff that's going on in our animals world and just the environment in general that we live in right now. The the body is wired to survive. So cells are wired to reproduce in an expedited fashion to keep up with cell death. And we aren't repairing the body or putting enough into our bodies and our animals' bodies to match that repair with the amount of cell death. So they go into this thing almost like an overdrive. They freak out, for lack of, scientific word. The cells freak out that they can't reproduce healthy cells fast enough. So they just start overproducing and they produce more and more and more and more and more till it kind of becomes manic, for lack of better words. They're just throwing cells out left, right, and center, trying to keep up. But the cells that they're producing are really not viable, healthy cells, and they start to mutate and they start to um uh they're misguided, they're reshaped, they're not our normal cell being born, then a normal cell death, and there's actually then becomes not enough death. And the cells just continue to reproduce and they reproduce in a really bizarre way. And a lot of that turns into cancerous cells. And we're living with, cancer cells in bodies all the time. So what I was looking at, or what I feel like we should be looking at, is, especially from a preventative perspective, is how do we protect cells, whether we're protecting it with our four-legged children, whether we're protecting it with our children or ourselves or our family. We want to make sure that our cells maintain their integrity and their health. And because when they don't is when things go awry. And they go awry, with, all kinds of things like autoimmune disease and childhood, juvenile diabetes and Addison's disease in dogs, and and severe allergies in dogs and asthma in kids and rheumatoid arthritis. And I mean, the list just goes on and on and on and on of how our bodies, and I say I don't differentiate between people and animals. They're a cell is a cell. So when it comes to what causes cell death with animals and with people, it's the same. And I would say the only thing different is that our animals there was a really interesting uh, article in the New York Times about how the environment is affecting our animals faster and more profoundly than it is people because they're very grounded, right? They're on the ground, 4 feet, no shoes. They pick up the energy of the ground. They're on the ground close to things like glyphosates and Roundup and pesticides and so they're more affected and affected faster by our environmental kind of destruction than people are. So we need to be paying attention to supporting our cells in a way that we're not trying to back up after there's been a diagnosis. Definitely, we're going to go into that for sure, like once there has been a diagnosis. But looking at it from a perspective of how, if we're wired to survive and then we go into overdrive, there's a couple things that have to happen. We have to allow the body to understand that it doesn't have to be in overdrive anymore. We got it, like you can kind of calm down now. And then there's another part where we prevent, right? We can try and prevent by arming the cells with the ability to fight what's coming after or coming at it from an environmental perspective, then and food and whatever, rather than waiting till an animal gets sick or waiting till we do get sick or just looking at it from more of a preventative space. But even from that preventative space, that for me, when I look at cancer and when I was working with cancer, with all that cancer in my clinic, I still looked at it in a very similar way because I believe that if you can get to the core and help the body understand what it needs to do, it can still do it, even with a diagnosis. It can either still do it or it can maintain its ability to function even in it. I can't tell you guys the amount of animals. Like I saw thousands of animals with cancer over the course of my career. And I even had people fly in from other countries to bring their animals to see us. And I think that, to say, oh, we cured cancer, and absolutely a billion, trillion, gazillion percent, I'm not saying that. What I'm saying though is I can't tell you how many times I heard, are you sure that it was the right diagnosis? I taking him to the park and people don't believe that he has cancer. Or, oh my gosh, he's eating and you wouldn't even know it if I didn't have the diagnosis. So I think when we're navigating cancer, a diagnosis of cancer, a very, very important part is to try and uh when you have an animal, what do you want for it? Right? So do you want longevity? Do you want quality of life? Do you want, you know, this time to just be, peaceful and grounded? Do you want to try and fight it at all costs, which means they're often in the hospital, they're away from you. They're, and I have no judgment on either one of those, but it's a really important conversation to have with your family prior to anything like that, including chronic disease. So not just cancer, but any disease process is like, what are we going to do? What are the, risk versus benefits? If there is, even if we do this chemotherapy, even if we do all of this stuff, and there's an 18, the mean amount of time that they're going to live for, the longest amount of time is like 16 months, something like that. In that 16 months, what are your expectations? Are your expectations that that 16 months is going to be this amazing 16 months? Are you prepared if that 16 months is half of that is going in and out of the clinic and having treatment and not feeling well? So or are you okay with keeping them stable and increasing their quality of life and being in a place that you're going to be okay, however long that lasts, because the time that they have is really good. So it's a very deep question to ask. And then there's one more, which is a combination, right? So you might do like prednisone or steroids, and then you can do alternative medicine with that, right? So you're doing like a combination of modalities and to with your goal being we're going to put steroids on board to try to decrease the inflammation, deal with the over responsiveness of the cells, but we are going to add all of these other things to help mitigate the effects of the steroids, but also try and decrease the tumor, try to increase their appetite, try to decrease pain. Like it's not, we don't live in an age anymore where there's just one way. There's a lot of different ways, and I believe that those you have to try and find out all the different ways that there are, and then sit down and really figure out what fits with your philosophy and your family's philosophy, so that while you're going through this transition with your animal, it's not chaotic and stressful and you're sort of not even present with your dog or your cat or your horse or your guinea pig or whatever. You're too much in your head. And I'm telling you this because I've done that. I've done that with my own animal, where I've been so focused on their disease and making them better or saving their life or however you want to call it, that I missed the window that I had with them because I was too focused on what was wrong. And the kind of I did that twice with two different, I've had hundreds of animals, but I've done that with two different animals. And I really learned my lesson. So I'm not saying it's easy because I was never like that with my patients. With my patients, I was very grounded and helped them stay very grounded. With my own animals, two times I really felt like I got too involved in their disease and I wasn't involved enough with their process and in the moment with them. So, cells are basic building blocks of all living things. They absorb nutrients, they convert it to energy, they help defend against infection and help the body move, grow, and repair itself. So protecting them really truly is vital. So what do we need to protect the cells from? Tons of stuff, right? Many things in our animals' everyday lives can trigger production of free radicals leading to oxidative stress. So processed food, pollution, pesticides, chemicals, stress, conventional medication, secondhand smoke, and fires now, like forest fires, like our air quality, even though it doesn't look bad because of the glyphosates and stuff that they're spraying on the forest, and then the forest fires are happening. The pollution in our air quality isn't the same as even just a normal forest fire that affects our lungs and our animals' lungs. So all of this oxidative stress can lead to allergies, chronic pancreatitis, hyperthyroidism, arthritis, Cushing's, chronic organ disease, and we're talking about cancer now, and definitely cancer. So um, when you're looking at that, what you want to do, what you want to think about is that antioxidants prevent cell damage. So they do that by neutralizing free radicals. So it's not like they're not being exposed to it. They're definitely still being, like, you can't prevent some of this stuff, but they're neutralizing the antioxidants before they can become oxidized. And this is sort of what I was talking about, what they look like. So an unhealthy cells that ravaged by stress due to damaging free radicals, they become irregular shaped, they can mutate, they start to reproduce too much in comparison to you see what a healthy cell looks like that's protected by antioxidants in its health. So I just have this is an old slide, so I just used it quickly. But this is one example of how you can help to support the cell, right? So free radicals cause cell damage and oxidative stress. And then that leads to chronic inflammation. And then that leads to chronic disease. And then that leads to more free radicals, causing more inflammation, more cell damage, and more oxidative stress. And then it continues. So this is an important part for everyone to understand for any kind of disease, is that when you get into this disease loop, and when you wind up getting, or animals get chronic disease, that chronic disease in itself creates more free radicals within the body. Forget about free radicals coming from um, outside influences. Your body actually creates them with this inflammatory process in your body. So, vital defense was something that we created through the research, some of the research that I've been doing at Dow, uh, to try and disarm free radicals, which then can help to derail that cyclical process by helping to protect the cells. So I'm just gonna stop sharing my screen for a minute then, and now we can just let's do this, and then I can get into a bit more later.
Okay, so I'm starting here with a bony pillar question.
Okay, great.
16-year-old female Shih Tzu diagnosed with chronic lymphocytic leukemia early September. This was a surprise, would have never known. Her energy, appetite, personality, poop, pee is great. Her blood work showed a small rise in alkaline phosphatase. She's been on the following Adorbis products for several years: chaga and turkey tail mushrooms, phytosynergy liver tonic, rotation of love bugs and phytosflora potency, omega-3. I have continued the recommended dosage. However, should anything be increased now with this diagnosis? Should I include Vital Defense? And if so, I'm giving her other supplements that include mushroom blends in addition to the chaga and turkey tail. So, how would I need to handle that? As far as fruits, I'm getting conflicting info, so I would like some advice on that too. Is pumpkin okay? Lastly, are there any homeopathic remedies specific to leukemia I could consider? Thank you.
So first of all, when I read this, she's 16, so congratulations. That's a very nice age. And then the other thing that would like to say is that you would never have known. So this is that's kind of showing you that you're on the right track, right? She seems fine, but then she had blood work and there was a rise in her elk phos, right? And she's been diagnosed with this. So I'm not sure if you're doing anything, Mariana. Maybe we can get her in the chat or somewhere where if she's doing any kind of um like drugs, right? If they put her on Prat, or if they've done anything as far as a drug, from a drug perspective.
Nothing. She just replied.
Nothing. Okay, and is she planning on it?
Are you planning on it and put her on any drugs?
So the as far as uh what is the difference between
Mm,
that so the I think
she
the
would
question
prefer not
about
to, if possible.
yeah,
Sorry.
yeah. So I would definitely support that. I mean, that's a completely uh it makes a lot of sense with a 16-year-old dog especially if she's doing well. I mean, that would make complete sense. So when it comes to chaga, turkey tail, phytosynergy, if you do vital defense, you don't have to do chaga, and you also don't have to do phytosynergy. But if she's been actually diagnosed with this, if she's not going to go on drugs, then then she can start vital defense, but I would keep her on turkey tail mushrooms. And the other thing that I would think about, she's on a rotation of love bugs and phytophthora. I would think with this particular diagnosis, I would consider putting her on a rotation also of soil and sea and wolf. Sounds like a lot of probiotics, but it's not when you rotate them. So you're not going to give love bugs, phytophthora, soil and sea, and wolf at the same time. You're going to you could do love bugs, or once you're finished love bugs, then you can, just do phytophthora, soil and sea, and wolf. You don't even have to go back to love bugs because the 14th strain is in phytophthora. So you could alternate them. So you could do like a day of phytophthora, then you could do a day of wolf, then you could do a day of soil and sea. Because what we want to do is we want in any cases of chronic disease or cancer or anything like that is to give the body uh a window of being able to have the most diverse bacteria it can have so that it can take basically what it needs. It can it can understand the body knows what it needs if you can give it enough diversity so that it can pick and choose. It will actually do that. It'll look at certain bacterias. It's incredible what the gut can do. The gut will understand what the body needs. So it'll literally grow. Like if you put 14 strains in, not all those 14 strains aren't going to be specific to supporting this particular disease. There might be five of them, but those five might be different than another dog's five with exactly the same disease. So the body will know what to ramp up when it comes to the microbiome and the bacteria. So the only thing that I would change there is uh I would change the addition of soil and sea and wolf. And once you finished your love bugs, you don't have to buy more love bugs, and you can just rotate those ones. Um,
She asked here if she can change or rotate daily. She have
yeah.
been rotating weekly.
Yes, you can rotate weekly or daily. With my animals, I often do it daily,
No.
right? Because then you're getting the different strains in more regularly, right? So, without overwhelming them by giving them all in one day. So, yeah, and then Vital Defense, I would use it along with Turkey Tail, and you can give them at the same time, or you can give one in the morning and the other one at night, whatever you would want. And as far as fruit, you're going to get conflicting everything. I like I said, I'm very, very much someone that is in the moment. When something's been diagnosed with cancer, my number one, yes, definitely I want to work, you know, to try and slow down metastases, slow down the progression, keep them as healthy and happy and pain-free as possible. But I really want them to be happy. And I remember getting some pretty sick animals, like really, really sick with cancer, and had been even on chemo, and people had decided to take them off because it was too hard on them. And I know a dog that had hemangiosarcoma, and we worked with this dog. And the only thing that dog ate for almost a month was toast. And I'm not joking. It was toast. That's all it wanted to eat. And then we started adding more things with the toast. And then she, maybe not a month, but at least 2.5 weeks. And everyone was like, oh my God, that's too much carbs. And oh, that's gonna make the cancer worse. But it was like I felt like, okay, this dog is 13 years old. She's got hemangiosarcoma, and she needs to eat. She needs to be happy. She needs to not feel sick. She's 13. She was pretty large. She was like a husky cross. It's like, let her eat what she wants to eat. What happens if she dies in 2 weeks? And we've not allowed her to eat. So I'm of the mindset that, clearly, and when she was eating, the woman was like making her sourdough bread. And so it wasn't like she was eating crappy toast or anything like that. She was eating really, really high quality bread. And this dog went on to, it was really, I'll just tell you the story really fast, sorry, but it is interesting. And that's why you can't, when you hear this person's a cancer specialist, I'm sure they are. I'm sure, like, oncologists, I think they're incredible, but I feel like we can't forget the individual that we're working with. And this dog went for a year. We treated her for a year, and she would get bleeds, and she'd have these vials of homeopathic remedies to give her when she would have bleeds, and she'd come out of them. And then finally, I just said, she wasn't in a position to have surgery, but her abdomen is getting so big. That's affecting her quality of life. I think you should take her back to the specialty clinic, and I think you should think about having surgery. So she took her back, and they're like, oh my gosh, she's still alive. That's unbelievable. Okay, yeah, their vitals are good. We're going to do surgery on her. We must have made a mistake. It must have not have been hemangiosarcoma. It must have been benign, right? It must not have been cancerous. It must have been a benign splenic tumor. So they went in, they took this tumor, they took her spleen out. I think her spleen weighed, I don't even know, 22 pounds or something. Like, it was this massive spleen with this tumor and everything. They sent it off, thinking, yeah, well, it was, we misdiagnosed it. And it actually came back that it was hemangiosarcoma. And she had been able to just live through this with lots of homeopathy and lots of different supplements and stuff like that. But what I think was the big thing is that they took that dog like day by day. And I'm telling you this because your dog is 16. And like day by day, that was what was most important, was they chose her quality of life. So they still took her on walks, and she'd have these bleeds. And the first few times it happened, I remember her calling me on from her cell in the middle of the endowment lands in BC, taking her for a walk, and she's like pure white, and she's like bleeding out, and we're giving her remedies. We're telling her what remedies to give her because she has this little first aid kit. Anyways, they took it out, and she lived another year and a half. So she lived 2.5 years after, like, in total. But she had the most amazing life. Like, it was incredible. So that's a big rabbit hole for pumpkin. But that's kind of what I'm talking about. Like, if she loves fruit, I would still give her fruit. Like, why did she get this? Why does one in every two dogs going to get cancer? Why didn't she get cancer when she was 6? instead, or 8 instead of 16. So you're doing something right with her. So I would say from a perspective of food, I would feed her what she wants. Like if she loves pumpkin, give her some pumpkin. If pumpkin helps make her poop every day, which helps things move and detox, I would give her some pumpkin. If she is liking fruit, give her a small, don't overdo it, but give her a small amount of fruit. So a 16-year-old dog that's doing well, and you're doing lots of supplements, I would be not being overly conscious of her food. And are there specific homeopathic remedies? Absolutely. Emily, did we find that, Mariana, for this? Remember we were gonna share the homeopathic, some of our homeopathic stuff for certain cancers.
The ebook, you mean?
Yeah, she did. She said yes.
Yeah.
Emily, can you tell, it's the ebook about homeopathic remedies and certain cancers, facing cancer in our pets, a guide. Yes. Okay, so can you put that in and Bonnie, I would download that or take that ebook. And there's remedies in there that are for specific cancers, but don't get too hung up on the specific cancer and look more at like when you're looking at leukemia, look at any of the blood cancers, look at any of the bone marrow cancers, and then read about them, and then you can choose which ones you think fit your dog the best.
Amazing. Thank you, Julie. Claudia is asking here, she has a dog with a fatty lump on his chest, and what are the pros and cons of investigating if she has mitral valve disease? So it's risky putting him through stressful situations.
Yeah. Well, if it is a fatty lump, you know it's a fatty lump. So, I don't know whether they've done a fine needle biopsy or they've done a biopsy on it. Maybe Claudia could tell us whether or not they've done a biopsy to know if it's a fatty lump. The thing with fatty lumps, you just have to watch they don't get too big, right? So they don't get out of control. Because even if they're not cancerous, they can be quite invasive if they get too big. So, if it's on his chest or her chest and it starts to invade some of the nerves around the scapula, things like that, then it can cause a problem. But if it is a fatty lump, like if it's a lipoma or something like that, then I would be doing the same thing. I would be detoxing, using preventative measures, right? Because there's a reason it's there. But one thing I would really, really, really watch is the type of meat you're feeding him. See if you can try and see if you can get non-stressed out meat, meaning meat like ethical meat. And it's even more important than organic meat when it comes to stuff like that, because when animals are stressed, they have really high cortisol levels. And when they have high cortisol levels and you ingest an animal, or a person ingests an animal that has high cortisol level in it, it turns into cholesterol and it can create high triglycerides. It can create bad fat. So, by trying to make sure that the meat that he's eating is low in cholesterol, so ethically raised meat can also really, really help, because yeah, having a mitral valve disease to put him out to look at this. He's an anxious boy. Is that okay?
And she mentioned that he's not had tests yet. The vet just assumed about the lymphoma for now, and he's an anxious boy. That's really, and she said that it's really helpful what you said.
Okay, so you can try that. You can be given Vital Defense. You can do turkey tail. Liver tonic is really important because it helps the gallbladder and the pancreas and the liver and the kidneys and all the organs that deal with good fat, bad fat. Uh, that would be really helpful to do. So that would be my suggestion. And just watch it. Like kind of give yourself a time frame. We're in November. Say I'm going to try these few things. I'm going to give myself till March and measure it, right? Like literally measure it. Like take a string, put a dot, like a little marker on your dog's hair, and take a string and measure the size of it, feel behind it. You'll know if it's getting bigger or smaller, and just watch it yourself for a little while.
Thank you, Julie. The other question here is from Robin. What steps, for example, homeopathy or herbs other than turkey tail and great nutrition will help prevent hemangi hemangiosarcoma? Thank you.
Help prevent it. Every single thing that helps prevent, like anything that's cell health. I mean, I'm glad that's why I was talking about that. So when we're thinking of cancer, I lump cancer in with chronic disease, and I lump every single solitary cancers in with chronic disease, and maybe unless, osteosarcoma from a trauma or something, or, you know, that might be a little different, but still, when you're trying to prevent disease, period, you want to do the same steps. Decrease oxidative stress, feed food that has the least amount of chemicals and stress induced hormones in the food, and reduce stress and increase joy. So because emotional stress can create just as much free radical damage as chemical stress can. So that would be the thing that I would be looking at the most, right? Just yeah, I mean, Hemagio, so I wouldn't turkey tail because of the Penn State University. Uh, all mushrooms are supportive for that. So, from a perspective of our products, I would say turkey tail, Vital Defense, in rotation when you're looking at prevention, and rotating liver tonic in there to make sure that you're detoxifying your dog, and gut health. Gut health is vital, and make sure that your probiotics are really super clean probiotics and have you know been scientifically proven to modulate the immune system. So that's another big important piece for anyone that's looking at trying to prevent disease is, like I said, cancer, it's the body kind of going rogue, the cells going rogue. Autoimmune disease, the body becomes in a state of hyper alert and starts to attack itself. Both of those things, chronic disease and cancer, has a similar thread in its physiology from a perspective of it's not under, right? It's not like they're not, their immune system isn't low, and you're not getting viruses and bacterial infections and things like that. That's very different. So those two problems, we need to be feeding the body things like probiotics that help the body understand when it needs to go up the immune system and when it needs to go down. We need to be putting in immune modulation. So for anyone trying to prevent disease, helping the body understand when it has to be should be a little more underactive, or when it needs to be overactive. But that's a rare case when you're talking about autoimmune and cancer.
Thank you, Julie. Cheryl is asking here, I have heard fermented things aren't great for cancer in animals. Is that true? I'm using a fermented probiotic right now. My dog has a mouth cancer.
Oh boy. Yeah. I mean, there is talk that um that fermentation increases histamine. So that's one of the reasons why some people are now staying away from fermented stuff when it comes to cancer or anything that's sort of histamine, like mast cell tumors, things that are um, triggered by histamine. So, that's all, that would be I'm just telling you why they're looking at it. Do I believe it? I don't know. I don't know. But if I was worried about it, if you were worried about that, then there's, lots of really good probiotics that aren't fermented. And there's just plain goat milk. So not fermented goat milk. So just plain raw goat milk that isn't fermented. So just, we went through a whole list of our probiotics because for exactly that reason, like which ones increase histamine, which ones decrease histamine of all the species that we have, because I look at that I take that quite seriously, right? If something, if we all of a sudden start to see that fermented foods increase histamine response, and not all cancer is histamine related, right? So, but if you're worried, it's an easy fix. There's lots of things out there that are amazing that aren't fermented. So you can still go ahead and do, foods that aren't fermented and um get your nutrition in a different way without it being fermented.
Yeah, she mentioned that the vet said no dairy, so she was feeding goat milk.
Well, goat milk. Yeah, but she can feed raw goat milk. Oh, is that she's saying that the vet said no, not goat milk?
He said no dairy, so
Well, goats are dairy. So, I mean, I don't know whether your vet's a holistic vet or not. Um, but there's a radical difference between pasteurized milk and whole milk. So vet said no goat milk.
yeah,
Does it say he does what?
it does muscle
Testing?
response testing.
Okay. Well, I mean, it's hard. It's a hard call. So, if you don't feel comfortable, if you think that his muscle testing is accurate, then don't. Then use other things. Use, bovine serum, use bone broth. There's lots of different alternatives to raw milk as well.
Thank you, Julie. Laurie is asking, what is a good remedy for nighttime pain relief for osteosarcoma?
Oy, oy, oy. So osteosarcoma is a big one for me. When I started my cancer research at Dalhousie, was the number one cancer I wanted to look at because I felt like it was the most misunderstood, and I still think it's the most misunderstood. And I felt like we had the least options for it. So when I mean, if I don't know whether you're doing gabapentin and things like that, but like if you're doing drugs for pain, I would imagine that you are. Uh, I don't know if you can put in the chat if you're using some drugs for
She mentioned homeopathy during the day.
homeopathy during the day, but so he's not on any drugs.
Just started
Gabapentin. Yeah,
gabapentin for
that's
night.
Yeah. So, with osteosarcoma, gabapentin is fairly well tolerated. Um, it also has a sedative effect, but there are different kinds of pain meds, right, that you can try that you can see which one works better for your dog from a drug perspective. And then what you do is you just make sure that give lots of liver tonic and give meloxicam made him sick. Yeah. So gabapentin, you can give Nux vomica and phosphorus are two remedies to help deal with the side effects of the drugs, right? So that you've got one eye on, okay, we're giving him the drug, but we're going to give him something to support how he feels from the drug. So that would be phosphorus 30C and Nux vomica 30C, and I would do it like 3 times a day. But the remedies, if the same thing, if Emily put it in the chat, Lori, go and download that because there's something in there for osteosarcoma. The the remedies that I chose mostly were aconite, arnica, chamomile, and symphytum, and really high potencies. Like if you can buy 1 Ms, 10 Ms, high potencies of it. And, if he seems more painful at night, you can start the remedies at like 6 o'clock and give it to him every hour before you go to bed so that you're sort of loading him up on it before he goes to bed. CBD oil, I don't know whether or not you're giving any kind of CBD oil, but CBD oil is good as well.
Thanks. Next here it's from Tony. If a kitty has an elevated T4, could this be an indicator for cancer? I have had 2 kitties pass away with cancer.
That's a hard call. Um, so many cats get elevated T4s with hyperthyroidism. They can have thyroid, like, I mean, it can, I've personally seen more cats with like lymphoma from that have had sort of inflammatory bowel disease. I've seen kitties that have IBD move into lymphoma or cancer if it's suppressed a lot, right? So if you're just doing the drugs for IBD, I've seen that switch pretty ugly into like many times. But elevated T4s are pretty common in older cats, like very common. There's ways of working with I just Dee Blanco, I just read she's a homeopathic veterinarian. There's lots of veterinarians like Richard Pitcairn's veterinarians that do homeopathy there's a pretty good protocol with something called Natmir and thyrodinum that people are using for elevated T4s rather than just jumping right into the drug. So maybe you want to look at reaching out to a homeopathic vet to help you deal with the elevated T4 before putting her on the thyroid medication. And, that could help to prevent stuff as well.
Great, thanks, Julie. Patricia is asking here, should you biopsy aspirate a tumor growth, or is that more likely to trigger it to spread, become more aggressive?
Yeah, well, it depends on where it is. So, and everybody's personal. At my clinics, we never did biopsies, especially fine needle aspirates. We really never did those, or rare, I should say, rarely. What we would prefer if someone really wanted to know what was going on, there's two ways of looking at this. Are you going to do drugs? Right? So are you going to do chemotherapy? Are you going to do are you going to go that route? If you're going to go that route, then you need to know exactly what it is. But if you need to know exactly what it is, we would always, and there were people that wanted to go that route with, at our practice. We would take the tumor right out, and we would make sure that we got as large a margins as possible, and we would send the whole tumor away. And that way they could do the histopathology and look at the entire tumor. And then we were not waiting for the tumor to get bigger and bigger and bigger and bigger. And then you have a harder time getting margins, because it becomes invasive, and then you don't have enough skin to close it off. So that becomes difficult. So, if your vet is leaning towards, if this is cancerous, we should remove it, and your animal has really clean blood work and it's doing really well, and they have a major concern that this is a tumor, like a cancerous tumor, then taking it out and sending the whole thing off would be my preference, or was the preference of the veterinarians at my clinic. And because often what can happen is, when you stick that needle into that tumor, if it is cancerous, then you can definitely aggravate it and make it angry. But you can also, when you're pulling out that needle, you're also pulling out cells that have been around that needle. So I always felt like you had a higher risk of spreading it through the very small vessels in the body. So we stayed away from that as much as we could.
That's interesting. Thank you, Julie. There's an anonymous question here. If I can't afford surgically remove my cat's mammary tumor, what supplements can help support her? I have her on turkey tail, vital defense, and Felix Flora right now.
Well, those are really good. Those are really good ones to have her on. And I would add liver tonic to that as well, so that we're maintaining, if there's like cell death, then you're helping the body to process that. Um, but from a perspective of cost, there's good remedies, like homeopathic remedies are not expensive and can be extremely helpful. So I don't know, what you can afford and what you can't afford. My friend, she's really, really busy. So Andrea Ring, you can, if somebody wants to put Andrea's contact in, that would be good. Especially for something like this, because there are like carcinosin, the remedy carcinosin, and she can tell you all of that, and she can dispense that and send it to you. But carcinosin is actually made from, it's a nosode, it's homeopathic nosode made from breast cancer. That's what it's actually made from. And people get, oh my God, like people get freaked out about it, but it is it's a there's remedies called carcinosin and conium, and there's lots of different kinds of remedies that have been um, used to work with, and I'm not saying it's going to get rid of the tumors, that's for sure, but maybe help them grow their growth, not to grow so rapidly, maybe help to slow the process down, um, uh, keep your kitty as comfortable as possible.
Thanks, Julie. Elaine's question is, what do you recommend for a 12-year-old Yorkie whose hair seems to be thinning ever since she had surgery to remove multiple bilateral mammary tumors 3 years ago? She's on a gently cooked diet with some supplements, bones broth, or goat milk.
Okay. 12-year-old Yorkie whose hair seems to be thinning ever since she had surgery to remove multiple bilateral mammary tumors. 12 years old. Is she, Elaine, is she spayed?
Let me see if Elaine is still here. Yeah, she's still here. Let's just wait a little bit.
Okay, maybe we can go back to that. Because if she's spayed, I have an idea, but she may not be, she may not be spayed, and that's why she has the mammary tumors. I'm not sure. But often when they remove the tumors, they'll also spay them at the same time. So just wondering if she was spayed or did they spay her when they took the tumors out? If you could let us know that, and then we can go back to that, Mariana,
Okay.
that question.
So Sue's it's asking if she just sorry, I'm just like having a hard time with her or this one. It's made me a little bit sad. I'm so sorry about that. But Sue's she lost her dog, her collie Golden, to heart cancer. And she's asking if it's like heart cancer on the rise, if you know anything about that.
My 9-year-old border collie, Golden, took heart cancer chasing a squirrel at the cottage. 3 days later, we said goodbye to by pulling around his heart. This is his heart cancer on the rise. Never heard about it before. It was a shock. Then I got scam trying to get a border collie puppy. We really aren't doing well with Gordy's loss. Oh gosh. Yeah. Well, oh my God. All cancers on the rise. Unfortunately, everything and bizarre cancers, like really like different types of cancers, really, vets going down a road because it doesn't even look like cancer and then it winds up being cancer. And it is cancer's on the rise, period. So whether heart cancer is on the rise, I would say that all cancer is on the rise, unfortunately. Um, but wasn't that nice that he was chasing a squirrel? Like, especially for a border collie, he wasn't just sleeping on the couch. He was actually out
Yeah,
doing
she
what a
was.
border collie, what a collie would be doing, which is, thank you for giving him a life that he went to a cottage and he was able to catch squirrels. Lots of border collies live in apartments and never get to even go out and do anything like that. So if that helps at all, um, I don't know. I don't know how. Yes, all cancer is on the rise. I lost Henry almost a year ago, and Henry was a Old English sheepdog cross, but he was very border collie-ish, and he was uh same thing. Like I can go back and I can think about all this stuff, and he wound up having osteosarcoma, and I didn't even know, and we took him and we had him x-rayed and everything, and they never caught it, and they kept thinking that it was a buttress from a torn ACL. And when I think back, and I mean, I had him on everything. And prior to that, about a year before that, he had a tumor in his prostate, and we dealt with that, and he recovered amazingly and came back, just as strong as ever. But, it was a blessing that I didn't know that he had osteosarcoma. And because I feel like if I had known, I would have been terrified to let him do anything. And up to the day we had to euthanize him, that's exactly what was happening. He was running down a cliff, um, and just moved the wrong way on this cliff and broke his leg. His leg just snapped in because the tumor had, moved, basically destroyed his bone. And I was sick about it that I, whatever, it doesn't matter. But my point is that he lived his life to he lived his life exactly how he wanted to live it till the very day that he died, or that we had to put him to sleep. So if that helps at all, I don't, I'm sure you were an incredible, incredible pet parent. And I don't know, I just maybe I don't know. It's it is. I just have uh yes, I have too many, they have too many rules. I don't know what she's saying. Um I don't know what she was saying. She just said something, but I can't find the chat. So
She's
what
saying
did she
that I have they have too many rules. I'm prepared to do all the shop. Oh, she's talking about the rescue, the border collie rescue that someone asked her if she
about?
contact them. Yeah, and she just mentioned before that you mentioned about the heart, how hard it is to diagnose the heart cancer, and she's saying that it like they thought that it was leptospirosis.
Initially, yeah.
Yeah.
Yeah, happens all the time. Like there's really bizarre cancer is getting more and more bizarre, really, like the different types and how it's showing up and how the what symptoms are coming up and things like that. So I'm really sorry that you lost your boy. And but the next dog that you get, I hope that you give him the same amount of freedom and love, and just try and think about what I was talking about cell health, right? Like helping to protect the cells as much as possible. And the same holds true for like heart and cortisol and stress and things like that. It's a big, it plays a big part.
There is this question from Grace. She's asking like, she's saying my big baby Rottweiler Nick is in a palliative care with lymphoma. What can I do to make her end journey easier for her?
Palliative care, is she in the clinic? She is in palliative care. So is she not with you when she's in palliative care, or is she at home in palliative care? Home.
Home.
Oh, okay, good. Um, well, lots and lots. I would say the first thing, if you really think that she's palliative and you're just um is when it comes to food, what we talked about, let her eat whatever she wants. Basically, she can eat toast, she can eat, like sometimes when they have cancer, they don't want meat, which is interesting, and if they do, they usually want it really well cooked. I don't know whether there's like a nausea element to it. Oh, she loves her food. Is that what she's saying? Oh, good. Awesome. So then, feed her. And I would be doing you can get our homeopathic called Go To, that really helps with pain, and if there's any kind of maybe you can even take it because it's for pain, it's for fear, and anxiety and stuff as well. But there's lots of remedies. Like, does she have any symptoms? Is she nauseous? Is she lethargic? Is she like, what are her symptoms? Lethargic. Okay. So there's a really nice remedy that called phosphorus. And you can buy it at the health food store. You could buy a 30C or a 200C. If you can find a 200C, that would be even good. And get our go-to and get some phosphorus and just give it to her 3 times a day. And if she's eating well, and she will take some turkey tail or some vital defense, then, even if you want to just do, fairly high amount, like often with turkey tail. That's helpful. But just was diagnosed. She's 6 years old. Yeah. So I don't know why you're like palliative, because palliative can mean just really lethargic. I mean, yeah, you know what? Go tomorrow if you can. Like go get our get our go-to and go tomorrow if you can and buy phosphorus. All right. And see if you can also get some vital defense into her. That's what I would say. Vital defense, turkey tail, um, um, maybe even some gut soothe. I don't know if she'll eat some yogurt, right? If she'll eat some like some Greek yogurt or some fermented goat milk or something like that and put some of our gut soothe in it. So gut soothe and vital defense and turkey tail. Like I don't like putting all that stuff in their food, especially if they're palliative. I usually get yogurt and put gut soothe in it and then some turkey tail and some vital defense and mix it all up and see if she'll take it in some yogurt. I would try that. And then I would go and I would get our go-to and go and get some phosphorus and you can mix uh and get a glass of water and put like 5 or 6 pumps of our go-to in a glass of water and 4 pellets of phosphorus, and then just put a lid on it or a saucer on it, let it dissolve, stir it, and then try and give her a tablespoon of that 3 to 4 times a day and see how she does.
Amazing. Thank you, Julie. Hmm. McLean is asking, Hi, Julie. Thank you for this opportunity. I have 2 dogs, 9 and 9.5 years old, Mastiff, rigid back, female, diagnosed, I guess, in July with anal carcinoma. Um,
Surgery.
Essex, sorry.
Surgery.
Oh, so thank you. Surgery done and she's on vitamin C and DMSO. Male now showing signs of lymphoma. Um, Lymphoma, sorry. Can you recommend first steps and perhaps how to eliminate what has caused this for both of my sweet pups? Thank you so much.
Yeah. Well, um, vitamin C and DMSO. That's interesting. I'm happy to hear that somebody's doing DMSO. Um, well, again, I keep talking about vital defense for both of them. And the one with anal carcinoma, I would do like what I was just saying, like from a perspective of um remedies. I would do the same thing that I was just talking about, phosphorus and go-to. And you know, 9 and 9.5, Jump for Joints has a high dose of arnica and symphytum. And symphytum is really good for anything to do with bone and blood and periosteum and all of that stuff. So it does help to support the blood, and so does arnica. So I would do that. And if you really felt like, you want to like again, get that thing that we just put in the chat, like the dealing with pet cancer,
The
the,
ebook.
the ebook. Everybody out there, if anybody out there right now is dealing with cancer, really just for sure take advantage of that ebook because it would be very, very, very helpful. But from a perspective of supplements, so from a perspective of remedies, Brenda, go and look at that ebook. And a perspective of, but I would start, like I said, you can even start with our Jump for Joints, go to and go and buy some phosphorus and put both dogs immediately on that. But uh and I would put both dogs on Vital Defense, liver tonic, and turkey tail. and a probiotic. So you can do the gutsu, like I said, and put all of that stuff into some yogurt for them. Or you could get with these guys, Mastiff Ridgebacks, you could get the Wolf probiotic, and just they need to be on a really good probiotic that helps with immune modulation, which the Wolf does. They need to be on, liver tonic to support their organs, and then those homeopathic remedies and uh vital defense and turkey tail. And when I recommend all of these supplements or products from us, the reason I'm recommending them is because I'm taking into the perspective, I'm looking at that perspective of trying to support their cells, and help the body do what's left to do, like what it can do. What I don't know what point all of these dogs are at, but it's very supportive.
Thank you, Julie. Brenda is asking, does combination or single remedies with homeopathy work better for cancer in cats?
I would say combination remedies. And the reason that I say that, I can say that very fast, is because our animals can't talk. It's they we we miss subtle signs because we're sleeping. We're sleeping, you give a remedy, something happens while we're sleeping, which would mean, oh, repeat that remedy, right? So when we're looking at cancer and the importance of staying on top of things and the importance of understanding the whole mechanism, the physiology of what's going on, I'm a huge combination remedy person. I did tons of combinations in my practice with amazing results with, anything from acute injuries to anxiety to grief to with, cancer, chronic disease, allergies. It doesn't really matter.
Amazing, thank you. Diane is asking here, my dog's father died from histiocytic sarcoma, and that is her direct relative. I would like to know if there is anything preventative I can do to avoid this cancer. She's already raw fed and has a holistic vet and gets many good probiotics and supplements. Thank you.
So that would be a dog where I would look at the histamine reaction of every species of probiotics that you're using. And I would be focused on the liver, right? Making sure that the liver stays clean and those, the whole portal system. And again, like I just keep repeating myself, like if you're trying to help support your dog or your cat or whatever, your pet or your animal, as best you can from getting, any kind of chronic disease, you really want to pay attention to, you know, cell health and reducing oxidative stress and reducing, like in that slideshow that are the slides that I used, really trying hard to reduce, if you can, reduce the factors that cause those things, right? So um getting food that is local, getting food that's ethical, getting food that is or organic or non-sprayed, or trying to decrease the assault on the cells in general so that they don't have to mutate and go rogue and go into this position of trying to survive and then causing a more severe disease.
Thanks. Dab is asking here, my dog was diagnosed with alimentary lymphoma in June. I treated him with Penacure and supplements. He's alive and well. I have added gut soothe, phytosynergy, and liver support along with hydrolyzed protein diet. Do you have any other recommendations? Not sure if he had cancer or severe IBS. Thank you.
Hmm. I feel like I'm repeating myself all the time, but I would imagine that everybody wrote in this, you know, like asked this question before I started talking about it. But I would add vital defense to that for sure. I would definitely add vital defense and vital defense and liver tonic. So those ones. And when you're on gut soothe, oh, he's on liver support. That's good. If he's on gut soothe, I would rotate soil and sea and wolf with that. So you're giving a very diverse uh amount of species of probiotics, which is, you know, really, really, really important. I can't even say how important it is, especially um, if he had severe IBS, I would keep him on the gut soothe for sure. If that was a question, I would keep him on gut soothe for sure. But then I would add those other two probiotics in rotation and the
Amazing.
vitamins.
Thank you, Julie. Maybe let's do one more or two more, just because it's 9:36 already. So Barbara, and this question from Barbara is I've there's some other questions that it's kind of asking about preventative measures. So maybe you can ask her question, and then I'll read like some other people will feel that they also had their questions answered. So my kitty has sensitive guts. He always had since he was a kitty. He is raw fed and no symptoms. He gets Adorbis probiotics daily and has been for 10 years now. My question is, what can I do now to ensure we won't get lymphoma and as he gets older? What are some of the preventative measures?
Um, no symptoms since he was a kitten. But he had a sensitive gut.
Yeah,
So if he can tolerate a rotation of turkey tail and vital defense, that's what I would be doing. Um, and Felix flora so that he has the feline specific probiotic in there. So Felix flora, liver tonic, vital, and then a rotation of vital defense and turkey tail is is definitely what I would do. Because again, you're looking at, that's why I was saying, like, the concern about lymphoma when they've had like IBD or really severe gut stuff, um, is always a concern with kitties. So, but he sounds like he's doing really well. But adding in those extra antioxidants, adding in those extra cell protection would be definitely helpful.
amazing. Thank you. I don't know if you want to go back to Elaine's question. She didn't reply anything. I tried to contact her. Oh, she's saying that she's here.
Okay.
Yeah. So, okay, so I'm gonna read again her question and then you can ask the follow-up questions that you had. So the question from Elaine is, what do you recommend for a 12-year-old Yorkie whose hair seems to be thinning ever since she had surgery to remove multiple bilateral mammary tumors 3 years ago? She's on gently cooked diet with some supplements, bones broth or goat milk.
And is she spayed? We asked if she was spayed.
Yeah, and that's Elaine. The question from Julie was if she was spayed. Let's see.
Well, I'll just tell her. And if she is, then If she was spayed during the surgery, then sometimes what can happen is or even sometimes the hormones that that are attached, for lack of better words, to those mammary tumors. It shifts. She was spayed at the time of the surgery. That's what I thought. Okay. That's exactly what I thought was happening. So what I would do is you can literally give Andrea Ring a call, and you can, from a perspective of paying attention to the cancer piece and the tumor piece, do what I've been saying to everybody, sort of like vital defense, rotation with turkey tail, a really good probiotic, a rotation of all of our probiotics, because they all have the the immune modulation perspective of it. And then if you can get a hold of Andrea Ring, if you guys can put her thing in there again, tell her that you would like to get the canine spay protocol, and luteinizing hormone, it's called. Because what could be happening is I mean, I don't know, I can't say for sure, but it sounds like her hair is thinning because she's had a very drastic hormone shift, right? With being spayed. And clearly she had high um, estrogen and hormones, or she wouldn't have produced her mammary tumors. And so now she's got none, and her body's probably going into like a hormone flux, like a bad one. And there are homeopathic remedies that can help support that, which is what I was just saying. Um, uh, the luteinizing hormone and it's called canine spay. I think that will help a lot. Um, I just want to look at something fast. Hold on.
Okay.
8-month-old large breed puppy, and they will tell me that the breed is prone to cancer. I have an 8-month-old large breed puppy, and they tell me that the breed is prone to cancer. Is this true, or is it just because of the foods we feed our dogs and lifestyle? If not, how can I try my best in preventing my sweetheart from getting cancer? So, every single animal, every single person, every single everything has a predisposition to something. And certain dogs have more of a predisposition to certain kinds of cancers. Certain dogs have predisposition to Cushing. Certain dogs have predisposition to hip dysplasia, collapsing trachea. The list goes on and on. It's how fast is that going to be expedited, right? Like how quickly are they going to, he's 8 months old. You can do a lot when something is 8 months old. So for me, 100%, it depends on your food and lifestyle. So there's a question that I want to um uh I'm gonna answer from this anonymous one at the same time. How important is having a clean environment when dealing with pet cancer? How much does a toxic environment affect the outcome? Massively, massively, massively. So 8 months old, try to not have Febreze in your house. Try not to wash your floors with hormone disruptors. Try not to have candles burning, scented candles burning. And every single thing that you do is going to help you. So this 8-month-old puppy angel comes into your life, and for you to be conscious to try and prevent him from something that he is potentially predisposed to is going to actually help you in your whole household and family. So definitely look at external environmental stuff, which is all around us. It's over vaccinating them. It's flea and tick medication. It's dead food with rendered ingredients in it from, you know, even, even vet food, like, like it does, I'm not going to name names, but you know, how healthy would you be if you ate from a can or a bag every day? So fresh food, you want to get food into them that has live enzymes, live antioxidants, um, rotating probiotics. This is a really good time for you uh, to be rotating uh, probiotics, right? Like we have a huge range of probiotics that you can rotate. So you could buy a bottle of Phytosflora. When you're finished the Phytosflora, you could buy a bottle of Wolf. When you finish the Wolf, then you can buy a bottle of Soil and Sea. And then it's not like you're giving them tons of anything. You're just doing a lot of rotation. At 8 months old, you could give him Vital Defense 2 to 3 times a year, and then you could give him turkey tail twice a year. You're just adding things to his young body to go, hey, you know, pay attention to what I'm giving you, because what I'm giving you is teaching your body to not have to go down that road, right? That you can do a lot with an 8-month-old dog. So don't pay attention. That's what I would say. Definitely pay attention, but don't obsess about it. And um start creating your home as a really, really healthy home for your little sweetheart plus yourself, right? Like do it for each other. So that's what I would say to you and to the person that asked me about the environmental um, suggestions. And then just underneath, oh, and the other thing too is I don't know if you've already 8 months old. I don't know whether he's been neutered or not. If he hasn't been neutered, I would try and wait till he was around 16 months old before neutering him, unless he's getting aggressive, and then I would do it earlier. But if you can wait, but he's probably already neutered, so which is fine. And then the other thing is
She'll
sex
be
hormone.
waiting, she mentioned, sorry.
I will
I'll
be
be
waiting.
waiting
Okay.
until
Well,
she's 2
you.
years old.
Okay. And he's not back. That's perfect. So you're already way on ahead of the game. And when you do neuter him, you can contact Andrea and you can get the canine neuter remedy, and you can get the luteinizing hormones, and you can get the different hormones from her. That's really, really important. And when you're vaccinating, we have something called um, they tell me that, oh, it sounds like she's worried about pyometra. So it's a girl. All right. I was saying it was a boy. Yeah. Well, pyometra is something to worry about. That's for sure. So, if you're worried, I had a really, really brilliant vet say to me once, if you're going to wait, do it after the first heat, but before the second heat. So you're waiting so that they can go through a full heat cycle, but then doing it before the second one. And that can sometimes decrease the risk. But when it comes to, I mean, I don't know what cancer they're talking about. Maybe they're talking about osteosarcoma. I don't know. But, doing I had a big breed. I'm trying to hurry because I know it's getting late, but I had a really large breed dog. I had a Mastiff Dane cross, and I was terrified she was going to get osteosarcoma. And I didn't spay her. I'm telling all these stories, but I didn't spay her and at all. And then I moved out here, and she was 7. She was 7 years old. I moved out to Nova Scotia, and we got a puppy, and it was a boy, Henry, and we never neutered Henry. And, I watched Della like a hawk when she would have her heats, because I was terrified of pyometra as well. I didn't know what I was more scared of, osteosarcoma or pyometra. I was scared of both. And uh she wound up getting pyometra. And I was positive that happened because she was around a male. So they tried to get, even though we kept them separate, They could smell each other. I felt like she was very suppressed, and she went into a false pregnancy, and then she did get pyometra, and she had to have an emergency surgery because it was closed, and she aged like 10 years, it felt like, quite quickly, like within a month of being spayed. She was really sick too, though. So you do your best. You do your best, but if you decide that you want to spay, or ovary sparing better than spay, um, yeah, it can be. Definitely, it can be. If you can find someone that's really good at it, and then you wouldn't have to do the spay and neuter ones, like the protocol, like as far as the homeopathics go. But when you're vaccinating her, try to get our rebalancer. It's really important for anyone out there that's still vaccinating in any way, shape, or form. We have a product called Rebalancer that is really helpful to give immediately after being vaccinated, and then for, a couple times a day for a week after the vaccine. So you can do a lot. You can do a lot. Just keep, and if she bangs her leg, I'm just thinking, because I don't know what this breed is, but every single time I had jump for joints because I make it. And every time Della hurt herself, like if she was running or tearing around like a nut bar and she would bang herself on something and she would cry, I'd freak out and I would give her some jump for joints because I didn't want her to have bone trauma. And she didn't get sore, like she did incredibly well. She lived a really good old age, and she was an incredible dog. But yeah, so rebalance her when she's gets vaccinated, grab a bottle of jump for joints. If she hurts her legs, if she smashes into something, give her, a couple doses of jump for joints just as prevention. And
And
then, sorry, go ahead.
it's a greater Swiss, she mentioned, Lori,
Greater
the
Swiss.
dog.
Okay.
Yeah.
Yeah. So you have to watch their legs, right? You have to watch their bones. I don't know if that's what they're talking about, if that's what they're concerned about, or if they're concerned about hemangio or what, but it doesn't matter. Cancer is cancer, and that's, from a perspective of decreasing chronic disease and preventing chronic disease, that's the way that I look at things. It's not the only way, that's for darn sure, but it's the way I've been, you know, moving around with my animals and all my patients at my clinic. But just this little dog, this next one, because that's a really different type of cancer. It's a hemangiosarcoma, but it's a subcutaneous hemangiosarcoma.
Mm-hmm.
So it's instead of the tumor being on the spleen, which is what it normally is, or more often is, it's on the skin, like it's in between the layers. So they had surgery to remove it. They removed two tumors. So they had good margins. His appetite is waning. I've started on some of our supplements, wondering if suggestions on food to support him and maybe more appetizing. He's losing weight.
Wait, yes.
So what I would suggest for this puppy is, I think you did get Vital Defense and liver tonic. And so I would, because he had the surgery, I would have him on, and I don't know whether you got go to or not. I can't even remember now, but I would have him on arnica for a while, because arnica is actually really, really good for hemangiosarcoma. Like any kind of blood diseases of any kind. Um, I would have him on that, and I would also go and get if his appetite's waning. So get some go-to from us and make sure that you're give it to him like 4 times a day. And then go and go to a health food store and get phosphorus. And if you can get 200C, get 200C. If you can't get 200C, get 30C. And do what I was saying with that other person, is put like 4 to 5 pumps of go-to in some water, and then 4 pellets of phosphorus. Let it dissolve. It won't fully dissolve. and then stir it and give not a very big dog. So give him, a few teaspoons, and you can just pull his lip out like this and dump it in his lip. So he doesn't even have to drink it. And so long as it gets on his mucous membranes in his mouth, he doesn't even have to actually swallow it. And if you can try to do that about 4 times a day, hopefully that will help to increase his appetite. And, for now, feed him what he wants to eat. Like, I don't know whether you're feeding him cooked chicken, whether you're giving him some kind of uh just allow him to eat right now whatever he wants to eat, not latent filled chemical dog food, or stuff that has a lot of like flavors and preservatives and things like that. But like I said, even toast, toast and things that are, and trying with different things all the time rather than the trying with like, oh, he's eating this, so I'm going to get him to eat this all the time. Just try him with different things all the time. See if he'll eat them. Try some nuts, like some uh different kinds of nuts. See if he wants that. You can, just whatever you feel like he would like to eat, so long as it's good for him. I would do that. And is there a scenario where is that, Mariana? Can't find it. You just put something in the chat, but my chat's like way high. Is there a
It's
scenario where daily liver tonic could lead to occasional dry, crumbly poop? No, no, opposite, because it's got glycerin in it. So if anything, it would lead to maybe a bit of soft poop, not dry, crumbly poop. Dry, crumble. I wonder, I wonder if he was on any kind of opioid, or um, was he on an opioid or anything like that? Or is he eating anything with bone in it? Like, is he eating any kind of food that's got really a lot of ground bone? Because that can definitely cause a dry, crumbly poop if they've got too much bone in their food. Like if you're feeding raw and you're feeding raw chicken, often raw chicken can have too much bone and they get dry, crumbly poop. Um, but yes, raw diet, no opioid. Okay, maybe there's too much right now. Maybe there's too much bone in his poop, in his raw. So maybe switch to a raw that doesn't have as much ground.
this Paula is not the same one from the question about the subcutaneous
Oh, it's not?
emissions.
Who is it?
No.
Paula. It's a different Paula?
Yeah.
Oh, well, okay. So doesn't matter. So Paula with with the hemangiosarcoma, the subcutaneous one, just do those remedies and feed him whatever he wants to eat right now. And I'm really hopeful that the remedies will maybe perk him up a bit, keeping my fingers crossed, because high potency arnica can make a world of difference. So, and I think even 200 C is fairly high.
Amazing. Thank you so much, Julie.
Hey, oh my God, look at them all still. Ugh.
Yeah, I know. Like there's still some
Well,
questions.
there's so many about prevention, right? I
Yeah,
haven't
there
really
are.
talked about prevention as much as I can. I mean, prevention's prevention.
Yeah.
And decreasing stress, increasing joy is a huge, that's huge on my list for prevention.
Hmm.
And even palliative, right? Even if you're navigating cancer, creating creating the space for joy with your dog is or cat is really, really incredibly important.
Yeah. Well, it was a difficult topic, like very
Oh,
intense questions, and it's not easy to talk about this. And I know we are still have some questions in the chat, and I wish we could have time to answer them all, but unfortunately, it's getting very late for us. So I have to end the webinar today. And as I always say, I understand how frustrating it is if you didn't have your question answered. So I'm so sorry for that. But if for those who didn't get their questions answered, please join our community on Facebook, the Adorbase Collective. You can post your question there, and we will be glad to help you. There's always someone from our team, them, and they're answering questions, and the community, the people in the community is also awesome, helping everyone there. You can also send us a question at questions@adorebeast.com, and our amazing customer service team will do their best to reply your questions. I would like to say that our vital defense that Julie mentioned a lot today, and that it's amazing to protect the health of the cells, is 30% off in our website. The promotion started today, so there's no codes. You just have to go to our website and place your order there, and the product will be 30% off. And I guess that's it. I would like to thank you, everyone who. Oh, sorry, go
Yeah, if
ahead.
somebody wants to see those slides too, right? Like we have the cancer prevent, like we have all for those people that are still on here, we have all of the slides from like our cancer research, uh, you know, webinar that we did.
Yeah,
And we have the slides from, our vital defense slides about cells. So for people that want that, if they reach out to customer service, we can find a way of getting the slides, right? For
yeah.
that.
So Kendra is asking if there's any code. No codes, Kendra. Just go to our website and Vital Defense will be there, 30% off. And I guess that's it. I want to thank you, everyone who joined us today, and thank you, Julie, for your knowledge, for sharing your knowledge, and for giving some of your time to us. And I don't know if you want to say anything else.
Well, I mean, it's the reason why we put Vital Defense on sale too, right? Is because it's cancer prevention or
Yeah,
cancer month. And it's a scary word, but I think if we look at the big picture, it doesn't have to be as scary as we, I'm not mitigating it at all. I've had my own animals with it. I've had, people I love in my family with it. So I'm not trying to make it less than, but it is what it is. And if we can approach it in a different way, then um I think it's a more positive, hopeful scenario of looking at it that way. But my heart goes out to everyone that's dealing with it right now or has dealt with it and has lost an animal or a family member or a friend. It's yeah, it's an interesting disease. And I'm determined to try and look at it differently and approach it differently because I think it's time that we approached it differently.
yeah. Thank you for that. And thank you for the research, for spending time trying to find not only like trying to give people a different perspective on this disease, but also to try to find some different ways to treat and to deal with
Yeah.
it.
Yeah.
Yeah. Thank you so
Yeah.
much.
And we're going to be presenting the another phase of the research. We just have to tie some things together and hopefully in a few months we'll be able to do the webinar on that.
Yeah, that will be amazing.
Mm.
Again, thank you so much, everyone. Thank you, Julie. I wish you all a
Anyway,
great night. And
everybody.
remember to subscribe to our newsletter. You can sign up on our website if you're not getting our emails already. By signing up there, you can get all the information about Adorbis, our promos, new blog postings, and future Ask Julie Anything sessions. Have a great night, everyone. Stay safe and stay warm because the winter is
Oh
almost
my
coming.
God.
Bye.
Yeah, bye. Thank you.